I'm hugely optimistic, more so than a lot of things that I read from national doctors, about how quickly this can end. I think we'll be shocked at how quickly our rates of COVID-19 will go down. There's a lot of pessimism, even for people that are pro-vaccine, some of our national leaders. I don't share their pessimism at all. I think this problem is going to go away quickly as soon as we can get the vaccines, if people are willing to take them, into our communities at large. We hope people will consider it seriously. It is safe. It's a reasonable way to take care of yourself. It's affordable. The side effects are almost non-existent. So there's an advisory committee that is going to formulate the stratification of who receives the vaccines first. The idea is that healthcare workers on the front lines will receive the first doses, but that will be followed very quickly, as soon as possible, by doses for those who live in long-term care facilities, who are the most vulnerable among us. There probably won't be a major amount of time in between these different strata of vaccinations, though. It's going to be less of an issue than people might think. For people who have already had COVID, your immunity probably wanes at about 3 months. We already have people in this area that have their second case under their belt documented. My understanding is it's not any more pleasant the second time around. And so you would be absolutely wise to get a vaccine if you've had COVID. You probably have immunity for a few months, but hard to say how long it lasts. We don't know how long immunity will last with the vaccine. We're hoping years. There's probably going to be some degree of boosters that are given by nature of the way that the vaccine works in the future. And that's okay, because once we end the pandemic state of COVID-19 and it becomes perhaps a seasonal thing like the flu, we'll know how to vaccinate against it to prevent it. It'll be hopefully a mild regional problem. I would hope that nobody gets it, but if we have a few people that get it rather than a pandemic, we can much more easily deal with it in a healthcare setting. It's a difficult question to answer because we don't have long-term data at this point. And this may not be the final vaccine that comes out. There may be other vaccines that are made available that work even better than this. In fact, that's the hope. We're hoping to always improve things. There's different levels of immunity that will be achieved by the vaccine, and it depends a little bit on the age of the person involved. And so some of these data that were reported just the other day on December 3rd showed that the antibody level did decrease a little bit with age, meaning there might be the need for a booster vaccine down the road sometime, and that's probably going to be the case. Possibly this becomes something seasonal, kind of like influenza, and so you might consider receiving a booster every year. Interestingly, though, the immunity of people who received a vaccine, even the elderly in this study, was significantly greater at 120 days after receiving their vaccine than it was for people who had just had COVID on average 34 days out, meaning you could be sick, miserable with symptoms 34 days later, or you could take somebody who had had a vaccine 4 months later, and that person who had had the vaccine 4 months later is many times better off with their immunity. That's important. That's good news. Well, the vaccines that are coming out hopefully soon, the two in this country, by Pfizer and by Moderna, are both very similar. They're both two-shot series. The Pfizer vaccine is the one that I'm the most familiar with. I was actually involved in that clinical trial. And essentially, we think that the immunity starts within about 10 days of the first dose. I've also seen 5 days reported. The idea is it's very similar to filling up your gas tank at the gas station when you're on fumes. The first few seconds of you putting gas in will probably get you to Rigby or to Idaho Falls, but if you keep filling it up until the thing clicks off, you'll have enough gas to go to Utah. Sometimes we like to top it off and add a little tiny bit more. Topping it off is probably what that second dose does. It doesn't do nearly as much as the first dose does, but it's helpful and it's the recommendation, so we do it. They're separated by 3 weeks, And it can be extended a little bit past that point, but 3 weeks is the recommendation for the second dose. That's called the booster dose. The first dose is the primer. Of the 18,904 patients with vaccine, only 8 had side effects that were significant enough to stop the trial, meaning they decided that they didn't want to take the second dose, whereas 5 in the placebo arm had side effects significant enough. Remember, these are patients getting a shot of saline in the arm. I was one of them. Hurts a little bit, but it wasn't too big of a deal. And so not only are those numbers incredibly low of side effects, but there's no real significant difference between those that receive the placebo and those that receive the real vaccine. That's good news. That means that there are no significant side effects in this very large group of people, such that they had to stop the clinical trial. That's a city the size of Rexburg without the college. And you can be assured that if there are major side effects to occur, not only would you have heard it, but also the fact of the matter is that most vaccine side effects occur within the first 24 hours or less time. And this has gone on several months now without any reports of any bad occurrences with side effects. So pretty good data, good news. The total amount of people in the Pfizer trial, and again, that's the one with which I'm most familiar, was around 44,000. They published data on around 38,000 of them so far. And the reason the disparity of the numbers is some of them were added later on. Some of those late additions included AIDS patients, other patients with immunity issues. A number of the patients had comorbidities that we see all the time, coronary disease, diabetes, COPD, and other lung diseases and things like that. And so it's a pretty good cross-section through a typical American population health-wise. And it was roughly, it was almost exactly 50% placebo. I was in the placebo arm because, again, I don't know how to be a winner at things myself. The 50% were in the treatment arm. The most common side effects reported were localized pain or swelling. There's a term we use in medicine called malaise. It's a catch-all bucket for feeling badly. People reported malaise. Typically, it peaked out at about 1.5 to 2 days, and then it went away. Those are the types of side effects that we would expect with any vaccine. And in fact, that's an indication that your body is doing something with the vaccine. That's your proof that you are building immunity. That's good news when you have some of those symptoms. You can take some Tylenol and throw a baseball for a few hours and work it out, and it'll go away. No big deal. Well, I think it's always reasonable to ask yourself a question: is there something long-term that we haven't seen, consequences unforeseen that might show up later? It's very unlikely. The way vaccines work is they work quickly to build immunity in hours and days, not months or years, although the immunity lasts months or years. I cannot foresee any long-term side effects. I don't think they'll happen. But what I am very well aware of is the long-term effects of COVID-19 on select populations. I wouldn't even say necessarily select populations as much as I would say random populations. That's probably a better way to say it. 40-year-olds that are healthy, that walk for a living for their job, that can no longer walk across a room without taking a breath. 70-year-olds who are hunting elk 5 days before they contract COVID-19 in Island Park, who are now dragging an oxygen tank 5 liters per minute, which isn't enough to launch the space shuttle, but it's getting close. There are a lot of people that are dreadfully ill from this, and it persists for months. Those are the long-term effects that I'm concerned about, and we don't fully understand what long-term effects will happen from COVID-19. I think it is absolutely imperative that we nip this in the bud as quickly as possible, and we have an opportunity to do so in a safe and effective and proven manner. Fortunately, in just the last few years, we have had some really groundbreaking, breathtaking advances in how we make vaccines. These are called messenger RNA vaccines. These have been around for a long time in equine communities. And so horse vaccines are mRNA vaccines, but we haven't figured out how to make them work in humans until recently. Essentially how these are made is you have it's almost like a 3D printer, if you will, that synthesizes a strand of nucleic acid in a freezer somewhere in Michigan or in Belgium, which is where they're making them right now. That is called messenger RNA. Messenger RNA is something that we normally produce off of our DNA. It's like a blueprint that's taken in the cell to another place called the ribosome. The ribosome, which is like the custom contractor that builds the house to suit, will then unfurl that blueprint and make the proteins according to how the blueprint describes it. Well, in the case of the mRNA vaccines, the Pfizer vaccine, the Moderna vaccine, we are creating that messenger RNA, putting it in a lipid vehicle so it is taken up by the cells. It's kept very cold at 70 degrees below zero. It's thawed out, thankfully, before it's injected. And once it's taken up by cells in the body, that blueprint is then unfurled in our cells, and instead of making the normal proteins for a short while that the cells make, they use that blueprint and they build a spike protein that is the spike protein on coronavirus. But there's no virus anywhere in any of this. That spike protein is then dumped out into the bloodstream by these dendritic cells, these other cells. And then your immunity sees that little flag staff with the flag flying on it and builds immunity to it. It's kind of like if the military were trained to recognize the flag of a potential enemy to the United States, they would realize the flag for what it is, a marker of an enemy, and they would act accordingly in their training so that if somebody attacks the United States with that flag, they would recognize it. There'd be a standing army ready to kill. That's how immunity works with messenger RNA vaccines. It's an absolute miracle how quickly these have been developed. Without this new technology, we would be doing the backstroke upstream, trying to find a vaccine for this still. After you get the vaccine, I'm going to wear my mask. I would suggest that other people do as well, but I think there will come a time when it's not necessary. I hope it's soon. I hate wearing a mask. I think most people, reasonable people that wear it, hate it as well. I think it'll go away pretty quickly as soon as the rates come down, which again will happen with vaccines. It absolutely does not contain live virus or any viral particles whatsoever. There is no component of the virus in this vaccine at all. It's a fully synthetic product. No viral particles, no killed virus, no virus in the factory that makes this. There's no virus. It absolutely is. That was a large portion of the enrollees in the clinical trial. They did very well. So we would expect that this would be a very wonderful and a very safe thing for those that are in that age range. You should convalesce from COVID-19 before you get the vaccine, so I wouldn't advise that. That arm of the data is going to be forthcoming soon. They added on another approximately 6,000 patients into the Pfizer trial later on, and so we don't have all those data, but those patients include patients with AIDS, patients with other immunocompromised. Certainly there were a lot of diabetics in the first arm of the trial, and we know that they did well. To some degree, there's immunocompromised with that. Age alone compromises one's immune system. And these patients that we do have data on seem to have done very well with the vaccine. So from my perspective, I can't see any reason not to get the vaccine if somebody has immunocompromised. It certainly is not going to give somebody COVID or make them more ill as compared to people who have an fully intact immune system. some of these data on how quickly the immunity kicks in with the first shot have just been published this week. I was reading some news reports the other day that shows that some really impressive immunity occurs within 10 days and maybe even sooner of the first shot. And again, that's sort of like gassing up your car. You fill the tank, the thing clicks off. You can then top it off a little bit more. It doesn't move the needle that much, but there's a little bit more gasoline in the tank. Based on the manufacturer's recommendations, we'll give 2 doses of this, but you're probably a lot safer than you had been within a week of the first dose of the vaccine. The answer is we don't know. Testing medications or vaccines in pregnant women is the third rail in medicine that nobody's going to touch. Interestingly, though, in the trial for the Pfizer vaccine, if women were pregnant, they were excluded from the beginning, but there were 23 women who became pregnant at some point, either after they'd received the first dose, or perhaps they didn't know they were pregnant when they received the first dose. But at some point in the clinical trial, 23 women became pregnant. 2 in the trial had miscarriage, and they were both in the placebo arm. So these are not data that are probably worthy of dissection much more than that, because it's such a small sample size. But it's interesting to note that so far, at least, there isn't any reported concerns with those 23 women who found out they were pregnant. There is absolutely zero chance that you can get COVID-19 from this vaccine because of the way that it is created. There is no virus involved in any step of the vaccination process, either in the production or the delivery. Some of the fears go back to what happened in the 1950s with some of the early polio viruses, and I can see where there might be some concern with people about that, knowing some of the bad history that happened. But that is not the case here, because there's no virus involved in the production of this vaccine. Won't happen. There's a lot of concern that vaccines might cause autism. There's no evidence of this whatsoever. It stems from a paper that was published in the British medical journals back in the 1990s, and it was thoroughly rebuffed and recanted in 2010 in the same medical journal. And the doctor that published those data lost his license because he made a lot of stuff up that was not true. And the fallout continues to this day, unfortunately. Autism is a very sad condition. Parents with children with autism deserve our deepest sympathy. But autism is not caused by vaccines. I tried to get one. I flew to Phoenix on my own dime twice to get a saline shot. That's part of science. There are placebos, importantly, in these studies, so that we can compare those who didn't get a true vaccine with those who did. So I tried to get one. I plan to be at the front of the line, or as soon as I can be, as a healthcare worker. My wife is excited about it. My parents are excited about it, and I'm excited to protect them and my wife's parents, people that we love. We want them protected. This vaccine will do it. And in my mind, I can see no other way at all that this problem will go away except for vaccines. We cannot expect that this will go through our community and that it will confer immunity based on people getting sick, like brucellosis through a herd of cattle. That is not the way that this is going to end, and it's not a reasonable thought at all. This will only end as we immunize, and we can thoroughly stop this very quickly. Academically speaking, I've had more interest in this problem than I have in anything else in my 16 years of doing this, because I've never seen anything cause medical problems like this before. I'm very comfortable with the research that I've read that this is how we're going to end this pandemic. I can see it happening in no other way. My encouragement is to get the vaccine. The wonderful thing is if we can all get the vaccine, we can all go back to normal very quickly. It's not years and it's not months. It's a couple of months. and we'll all be protected. We can go back to playing ball, watching ball games. We can go back to church and other worship activities that we've all been missing. And really, there is probably no other way that will happen.